move down to the foot of the bed and the pump. Firstly, I'd like to talk about the transport mode. You would use transport mode when you're transferring a patient from ward to ward, or if they're waiting to go into another procedure. To put the motor into transport mode, all you need to do is to turn the umbilical cord anti-clockwise. The umbilical valve will automatically shut off and prevent air leakage. As you can see, the pump is on an active medium setting. If you have an 80 kg person on an active medium setting in transport mode, then the patient should not bottom out for up to 8 hours. Now, if you have a heavier patient or a patient with a larger BMI or someone who might be quite active or independent with more mobility, then you may want to look at increasing the comfort setting up to a firm or a seated setting. You may also want to put it into Maxflat. This way you have more air in the mattress and you'll have more time before the mattress will bottom out. I'd like to draw your attention to the comfort settings. When the mattress is installed and it turns on, it will automatically default to active medium. Now, if the patient is saying that the mattress is too soft or too firm, then you have the ability to adjust it down to soft or put it up to firm or a seated setting. To adjust the comfort settings, as you can see on the screen, it says locked. Firstly, you would need to unlock the motor. To unlock the motor, hold down the second button in, which is the unlock button, for 2 seconds. The pump will then beep and you'll be able to adjust the comfort setting. At the moment it's on medium, so to put it up to firm, just press up. The motor will then automatically lock again after 2 minutes. If your patient is unable to communicate, then I would encourage you to use your clinical reasoning and decide what would be the most appropriate setting for your patient. For example, if your patient has a really low BMI or a lot of bony prominences, or they may have scored quite high on an assessment tool, then you may want to drop the setting down to soft. I'd now like to focus on the therapy mode button. The therapy mode button gives you the ability to change the setting either from an active cell cycle or to change it to a continuous low therapy static mode. So when would you use this button? You may use this button if your patient is extremely hypersensitive to any type of movement. Therefore, they cannot handle any type of active motion, so you may want to drop it or transfer it to a static mode. You may also use it on an orthopedic ward, a burns unit, spinal injury unit, or if someone's overcoming a fracture or has an unstable fracture and they have been cleared by their general practitioner to go on an active or air-powered air mattress. Here we have the information button. The information button is really for our Talley technicians, our installers, or for your biomedical department. The information button allows us to identify the product serial code, when the pump was last serviced, when it is due for a service, how long the motor's been running for, and also the last 5 faults. And lastly, the Maxflat. The Maxflat is a really valuable tool that all clinicians can use in a facility setting. The Maxflat allows us to fully inflate the mattress to an extremely firm and stable setting. The Maxflat can be used for patients when assisting with their sit-to-stand transfers or their sliding bed transfers from the top of the bed to the bottom of the bed, or nurses might also use the Maxflat when doing their bed bath, hoist transfers, or physios might also use the Maxflat when they're doing their physio exercises on the bed. Now, to use the Maxflat button, once again, the motor has locked itself. You need to press the unlock button down for 2 seconds to unlock, and just press Maxflat once, and based on an active medium setting, the motor will take 3.3 minutes to fully inflate to a firm setting. After this time frame, the motor will beep 4 times to indicate that it's max inflated and you're ready to do your transfers. After 15 minutes, the pump will automatically default back to the previous setting. Now I've ran through what all the buttons are for on the pump. However, if you forget what the buttons are for, on the back of the pump there is a key guide which details what each of the buttons are for. Also on the side of the pump is details and instructions on how to put the pump into transport mode. We also, on the top of our pumps, we have a 24/7 1300 phone line. This phone line is available for troubleshooting, for ordering or for any other inquiries.